I dey hear you loud and clear.
Happy Sunday.
Yes, happy Sunday to you. So today's discussion is a different discussion on HIV. I know one may we dey talk about what is HIV, which and this. No, we go dey engage all those information where people get for inside their brain, where they make them fear, where they talk say, I no go fit, I beg, I no go fit. Now those ones we go discuss tonight. Because somebody they talk right now, Dr. Israel, and I want make you fire down immediately. No time to waste. He says the fear of knowing that a guy is HIV positive. I go run. I go run. So, Dr. Israel, over to you.
Okay, yeah, I not blame this person because not be lie. Not be lie. Most people once they hear say person get HIV, they go run. It's not their fault. It's because of the knowledge or what they know about HIV. So if
If they
they
don't
get good
hear.
knowledge about HIV, they're gonna say they're not supposed run. Or if they still feel like running, is what they want to do. Another thing is that I keep on telling people, like, if I get HIV today, and I tell one girl, say, oh, I'm HIV positive. If he run from me say that girl not love me before. Because if we say love conquer everything, it means even sickness, love supposed conquer am. Yeah. So if the girl leave me because of say I get HIV, it means say that person not like me. That one thing we need to know. Because people get things way bad, way worse past HIV. Many things
Yes,
dey way
now.
worse past HIV. Just that we understand say HIV, the way it take come, it gives so many people things to talk about. And apart from that, the name when so many tribe call HIV is still doing wetin they give HIV that strong stigma. You go hear say some people don't call HIV there in their language. Wetin e mean na person wey don die or person wey dey on his way to kpai, na e mean. So when you start to dey get all those names, some people they not now they make them they run from people wey get HIV. But today I need you to know say whether person get HIV, e not change anything about that person. Everything about that person is still complete. So you don't need to run from who get HIV because the stigma feel by person more than the disease. If we keep on to the stigmatize people because of say they get one one disease or the other, example HIV, they go feel even
Yes.
quick die pass say na the disease na come kpai them. So make we try. So for you as a lady or a guy, your partner or your friend come tell you say, hey, I be positive to HIV. You don't need to run. You don't need to run. You have a role to play. One of the roles is to encourage this person so that make them they happy, make them know say yes, there's somebody that understand what they are going through. What they are going through. And if then they take their medication very well, they're not going to transmit the virus. That's the good thing. Some person not even 1 year that one self. But that's the truth. If they take their medication very well, they're not going to transmit the virus. Now, it is also good for you to know, say, even before even taking medication, when we look at the percentage of how this transmission they be, sometimes even they minute. That make even in some cases when some people never even start, they never feel even transmit the virus like that. So please, if you get somebody when they positive, or you know anybody when they positive, not run from that person. If you like that person, say you feel like you believe in your mind, say, oh, this person supposed to be my partner. And brother, my sister, go ahead. It not change anything. And this person go see if he give birth to children, the pikin go still be negative. This person feel you with the person feel day together, and nothing go happen to you. So no fear. Just only encourage that person, make the person for do the right thing. Dr. Fred.
Yeah, thank you, Dr. Israel. Somebody said they know they see me. You they see me at all, Dr. Israel? Can you see me?
No, I not see you. I even say now you not get light.
I don't know why you cannot see me. I don't know, but they show me for years. Say I did on the screen, but I don't know. They check now through the other device. And they show me. So I'm so sorry now they see me. I don't know why it happen like this. So what I'm going to try to do, I go make sure say you continue, then I go come out and I'll try come back again. Sure you understand. Now you get one
Okay, no
comment where I
problem.
go
But
like
yeah,
you get one comment where I go like put on the screen. Agnes, do you want me to put your comments on the screen? If yes, let me know. Okay, now, Dr. Israel, this person says, what if someone was exposed to HIV years ago and still test negative?
now you exposed does not mean say you get the disease. Exposure means say you do things when fit make you get this get HIV. Does not mean say is equals to get HIV. And some people don't, and some people because they okay, like I dey work for hospital. I mistakenly chook my hand with needle of somebody when I don't know HIV status. I have exposed myself, but it does not mean say I go get HIV. And it don't mean now. I go do test. If it's negative, I do the normal things when I supposed to, and I'm free. If you expose yourself in any way, whether through knacking or through any way you take expose yourself, whether you even know the person status, say now positive this person be, and you go do test, maybe you don't even know what you are supposed to do. Let's assume you don't even know what you are supposed to do, but you do test. Yes, your picture don't come out now, but you do test and it was negative. And after many years, you still do test, it was negative. It means say you are negative. It means say you were never infected. So being exposed is different from being infected. In fact, we are exposed to so many things in this life, so many diseases, all the bacteria and many things where they touch people body, we are exposed to it. So you can be exposed to many things. You can be exposed to HIV, but it doesn't mean that you are infected. It doesn't mean that you are infected. Yeah, Dr. Fred.
Okay, yeah, thank you so much. Yes, I don't show. Thank you so much. Now, so you get one question where I see right now, or one comment. The person say, doctor, how somebody fit take note say he get HIV for body? Because I hear say if you meet somebody, as you meet the person, you enter your body, it go start to dey cause you sickness. You see that it go just enter, it go start, or you go dead the person body, go dey cause you sickness, you no go know. Now say okay, quick, it go go. We'll talk about them today, so that how you go take even know say this one no, if it be HIV, this one no be HIV.
I make video on this question when you talk. I do routine no say person get HIV. So if you follow me, you can have. In fact, now one of my recent video be that say. So for you to be sure, for you to know say yes, this person get HIV, the person must have done test, and the test go
Mm,
confirm say this person dey positive. If you not
mm,
do test, you not get, and somebody say you get HIV and you not do test, you not get. Those are just a
mm.
suspected case. There's difference between suspected case and confirmed case.
Confirmed
So
case, yes.
you are suspected that you have HIV, maybe based on the signs and symptoms they are seeing, but does not mean that yes, this person 100% have HIV until they do test for this person. Now, after they do test, that is when you can actually say yes, this person he gets HIV. So that one and one. And another thing, yes, there are some things you need to, when you see, yes, it will contact you say, may you go do test. However, these signs and symptoms, they are not equal to you get HIV. Say because you see all these signs, it means say you get HIV. No. It means say it's a pointer. It's a pointer for you to go and do your HIV test. So if you sick all the time, within 1 month, you don't sick like 3 times. Even within a year, it be like say every month or every 2 weeks, you dey always fall sick. Go do HIV. Try do HIV test. Let HIV test be part of the test wey you go do, apart from every other test wey you go do. You dey cough and the cough no gree go, abeg do. You come dey lost weight, do. You come dey get rashes for your body wey you never understand the kind of rashes, do HIV test. You can't dey purge. Stay almost 1 month. You dey purge. You dey go toilet na so water. You eat food. The next thing you don't go purge. Go still do the test. Remember as I talk, it not mean say you don't get am. It's just a pointer. Say it is time for you to do test. You can't notice say your mouth, your tongue, they white. You brush in the whiteness not come up for your tongue. Go do test. For women, your quickness, you can't say white discharge. When many well. Sometimes you need to go do test. You need to still go do test. You can't I don't talk ratchets for body. Or you can't say what they call genital wax. For your for the anus and the perineal region. I beg, do test. Do test. It is very, very important that you do test.
Yes.
Now, all these things, most of all these things now, one of the things to show say your immune system go down. It's also good for you to know say not be only HIV if you reduce your immune system. Many other things will reduce your immune system. Now, make once you see all those things, I beg, go do test. Not just leave am. Go do test. Now, only when you do test, now you go feel know if you really get or you no get. Or you dey feel one kind thing for body, you no understand what you dey even feel. You just your body not just dey okay to you. You just feel say your body not dey okay. Go do test. Go do test. So, Dr. Fred.
Yes, thank you so much, Dr. Israel. Because I dey see a lot of comments right now. But I want, if you know say you dey watch this video, share this thing because some people now they cry, say my life don't spoil because I go do test. Remember, Dr. Israel, they shout, go do test, go do test. Somebody go they tell you, I beg, I no go do test. If I go do test now, you go they see sickness when you do my body. I no want know whether I get HIV. If I go know, if it find me, what is the danger? If person no do test, person no know, say he get HIV for body. Many problems fit happen. And that is why it is important that we talk about the dangers of not testing. Everybody listening to us now. Why is it important that we need to test? Dr. Israel, more fire down and then start sharing this video quick. Make more people come learn.
Okay. It's very good for us to do tests. It's very, very good. Now, if you not do test, one, you're not gonna know what you go treat. Because if you do test, you can't be positive. You mean nothing than to start your medication so I may you feel they are alive. But if you not know, you're not gonna know what you treat. You go they take only malaria drug, and your body go they go. Before you know, you say na village people. Where village people don't get anything when they do you. Two, you go they spend money unnecessarily. Because you go they treat yourself, Now money you they spend. Whereas if you have done the right thing, you're not going to spend money too much. Three, you feel become time. When we say time bomb, it means you feel they spread this disease to other people. And because you don't know that you have it. And all those people still don't know. And then mostly your partners. And if you get one partner, that your partner get other partners. Like you see, I say from one person, if you don't spread on to almost 11 persons already. And because if you not do one like this, apart from you when it affect your family and it affect the nation at large. It affect the nation at large. I remember say if you fall sick, you no go dey productive. So if you're not the productive,
yes, now
you not go fit bring out money for every other person to use and even for yourself to use. And if you're not the productive, your knowledge when you know, you cannot share it with other people. And if you not do test and you can't be saying I'm positive, you don't they sick. You can't go finally know at the end. You feel even start the medication, but you feel not make up. So by that one, we don't lost a resourceful what I call it now. One wonderful product. Let me use that word. or something where they're very special, not only to yourself, but to your family. Eh? So that is why it's good when we do tests. I know some people they fear to do tests, but it's very important. At least once, if you know, say you not to get anything within your mind, you know, say I not to get anything where if it make me come down with HIV. At least once a year you should do test. Eh? But if you know, say man, I get this, twice a year you should do test. Eh? So just test yourself to the sure. So I they safe on uh this part of my life. Dr. Fred.
Yeah, thank you so much. Because Israel, I know somebody. He go tell you say, my sickness na malaria they always treat. Go they treat malaria. We dey beg am say, can you just at least try to get yourself tested? He say, make una leave me. I know my body. I know how my body they do me. And na malaria they always treat. And I'm malaria my sickness. But this person did not realize that. Now sign the body they give and sign. They give and sign. By the time the person can't go hospital, when they come force am, and that time the person can't go test, and the result came out positive for this person. And this is why, as Dr. Israel don't talk, it dey very important say you get yourself tested, so that all those other complications, spreading it and you wasting money and you getting very sick and exposing yourself to other infections, all those things go dey very little. Some people never still share this video. So if you never share and you ask question, we no go answer you. I no go read your comments. If you no share this live session and you drop question, nobody go answer you because you are stingy. You understand? You want me to answer you, but you no want also share for us. So you have to balance it. Now, Dr. Israel get problem. I don't know what they happen. People are always afraid to run HIV test. Yes, Joanne. People they very afraid. Why did they fear? Number one, ignorance. They don't know the things where they don't hear about HIV. They make them fear. Number two, they believe say when they test themselves for HIV and they are now positive, their world don't spoil, their life don't dabaru. Not even knowing that they can live perfectly well. Not even knowing that you get other worse sickness where they outside, way past HIV. So that is one reason why a lot of people they fear to go test themselves for HIV. And some of these people feel don't even marry. Some of them feel their relationship and they go they make way. They go they open way. And when you don't know, say this in there your body, you they make way like this, you they carry and give that person, which is not what, which is not good. And Dr. Israel, are you back? Okay, in network, Dr. Israel's network, they do somehow. Uh the network they do somehow. So okay, he's here now. Okay, good. Yes. So share now. If you they see us for the first time, and this program now every Sunday by 8 p.m. Every Sunday, 8 p.m. And we don't they do them for the past 5 years. So not be today we start. And today we are talking about HIV. I beg, we know they give number, we know the private chats. If you get any medical condition, go speak with your doctor. We just dey here to teach you, to educate you, to ensure say you live fine and they no chop you. I make us dey here. So we know they here they private chat anybody. Now we get one very important question here. The question say, if one partner is positive and the other partner is negative, and this partner that is infected is on medicine, can the other person also get it? This question is coming from Eki Precious. May we carry on.
Okay. E get wetin they call discordant couple. Discordant couple means say one partner gets HIV while the other one not get HIV. And it's about 24% or more. Now they this word for discordant couple. So not be say na today thing. Many people don't things to it. So if the one where they positive, they take a medication very well. Listen to the word when I talk very well. Ask the doctor, tell am, make it say they take the drug, and if they adherence to it,
Mm-hmm.
Hmm? It go reach a point when a viral load, that is the number of virus wey dey body, go come become undetected. That is, it come dey very small. Undetected, that is from less than 50. Now we dey call undetected. WHO now bring that, and I put that target less than 50. So you go get to that extent. If you get to that extent, this person no go fit transmit the virus to any other person. So e partner go dey safe, because you no go fit transmit the virus to a partner. We get a lot of them already. Not be saying that today. I said there are almost 24% already for the world population. If you calculate and you suppose know how many that number go be. So it is very possible. Another thing wey you need to know is that they go fit still get belle and give birth to pikin, and that pikin go fit still be negative in only one condition: if the person wey be positive dey take im medication very very well. Also, we still get wetin dem dey call PrEP, prevention. Yeah, and one of the
Mm.
prevention na PrEP, which is pre-exposure prophylaxis, meaning say e go
Mm-hmm.
take medication before e expose himself to anything wey fit make am get HIV. So if that partner as well that is negative still dey on PrEP, e also no go fit get the
Mm-hmm.
virus as well. So you can see say, one, the person wey
Virus
get the
as
virus
well.
must dey take im medication very well, make a viral load come become undetectable. And two, the other person can also be taking PrEP. If that person wey be negative dey take PrEP, e no matter whether the positive person dey take a drug very well or not dey take a drug very well. If that one dey take PrEP and dey take am very well.
Very well.
But we dey always encourage
Well.
and we dey
Yeah.
always tell people, let the one wey dey positive dey take im medication very well, because e go help am. E go help am and e go help the other partner wey be negative. Dr. Fred.
Yeah, thank you. The questions we get for here, the questions plenty. Now, but I want me we talk this one. This one they very
I think
important. Me we take because we go. You say waiting.
make we just dey take all their questions. From their questions, we feel they get many things to talk about.
Yes. The questions. We're taking the questions because of time. Let's take the question. So this one says,
Yeah.
someone that tests positive to HIV, can she still get pregnant? The answer now yes. Now, Clint, if you listen to which Dr. Israel talk, person will get HIV, if he marry, if he born, nothing will happen. So yes, the answer is capital yes. Capital yes, because we get many comments. I want more with day fast. And the answer is yes. Someone that tests positive to HIV can get pregnant, and the pikin no go dey positive, the pikin go dey negative. Just that this person, when she dey pregnant, she go hospital. They go need to enroll am for a very special program for those people wey dey live with HIV. They will come, they give am medicine, they go counsel am, so that when she born pikin, her pikin no go get am. But if she no go hospital, if she no listen to her doctor, if she just tell you say abeg no concern me, there's a high chance that she fit carry and give that her pikin for belle. So we have a question here. Dr. Israel says, how long before go dey detected have contacted HIV? How long is it going to take before he will start noticing the symptom in the body? How long?
Okay. The thing is this: when person gets the disease, we get what they call acute HIV symptoms, or acute HIV infection. Sorry, acute HIV infection. Though the acute HIV infection, there are some symptoms when they follow, and those symptoms are like malaria symptoms. They are flu-like symptoms. So when the person get the HIV, bah, once it's done, they infected. Those are the first things when you go feel. But you not go even know say na HIV because na normal symptoms. Yeah, I feel you're feeling for the first few days, and after that, everything will stop. So that makes sometimes we they say HIV na asymptomatic. So HIV gets
Mm.
acute phase, latent phase, and AIDS. Those are the three main phases of HIV. The acute phase now about 8 weeks or so, 8 weeks, yeah. So within that 8 weeks, for the first 3 weeks or 3 to 4 weeks, the person fit get that acute HIV infection. That is, you fit those flu-like symptoms and all those things, and you're not going to say you get HIV. You go, you have to say na malaria or na catarrh you get or na cough you get, and you go take medication and everything go. Wetin dey happen that time now be say the body dey try to fight, the body dey try to build the immune system. So the body dey try to build antibodies, so that make dem dey fight against the HIV. So after that acute period, we will come enter wetin we dey call the latent phase, and this latent phase can stay as long as 12 years. In this latent phase, the body don build antibody, wey be say e don hold the HIV, but not be say e hold am well well, but at least e fit make the person dey feel like say nothing dey do am. And the last phase, which is the 8th phase, na about 2 years. So if this person not take care of himself within this latent phase, by that last 2 years, anything fit happen. So for that latent phase, this person fit dey do all latent mean quiet state. That is, you feel like say nothing dey do am. So this person fit just be like say nothing dey do am until maybe later you're gonna feel all these small, without mention all those symptoms before. Gonna feel all those small symptoms. So if person dey infected, that first few period before the antibody come and now make we dey talk about windows period. Say for the first 6 weeks, some test kits fit not pick am because the body never build enough antibody, because na antibody now we dey look for most of the kits wey we dey use, those determine and Unigold, and most of the time na the antibody. So within the first 4 to 6 weeks, the body fit never build those antibody. But sometimes in some people, within by the 6th week, the antibody fit don come out. So when you do the test, you go know. So now only when you do the test, now you fit know, say yes, this person is positive. If you do test and it's negative, for that period it's negative until you go repeat the test again. I know say the next question will be, oh, I do test this week, is negative. The next week I can't do it, can't be positive. Wetin can happen? It means that the test kit not good or not. One, the test kit fit not good. That and dey on its own. Two, if it be say, as at the time when you first do the first test, you dey on your Windows period. By the time you come do the second test, there's already a seroconversion. So the person already convert to become positive. Yeah,
by
so
that time.
it happen like that. Dr. Fred.
Yeah, thank you, Dr. Israel. I dey see the questions plenty well. People like this topic. They ask a lot of questions. But at the same time, I need you to show this video to many people. If they say we dey here now, they share this information, so that our people no go to cry for inside their house. Say, doctor, una no explain to me, una no teach me, una no answer me. You go come dey cry, say my sister did not know this and that. So share this video. Save people life by sharing. Yusuf, you are now a doctor. So let's go back quickly to the comment section and take a comment here. This person, when we try to do very fast, he say, why is it that it is mostly health workers that discloses their client status to outsiders? This is wrong, not true. Because health worker understands medical ethics, and when you understand patient confidentiality, so health worker no dey disclose patient status to outsider. You understand? Health workers no dey do am. Even before dem test you, they go counsel you. Even if you dey married, they go tell you, say, you go use your own mouth tell your partner. No be the health worker go tell your partner for you. No be our job. Now you, the person where they positive, nine go tell, they go they encourage them, they go they beg them, let this person know. Person go they say no, I beg, I no one tell them. So it is not the health workers. Do you understand? It is a wrong interpretation. Maybe somebody for somewhere don't go bring up one story, but it is a very wrong interpretation, a wrong mindset, and a wrong belief. Flora, I hope I address this. Okay, so do you want to say anything quickly?
Yeah, yeah, Flora, I understand your concern. We know say sometimes not way not they happen for anywhere, but it is against the ethics of every medical professional to disclose their client's information or their client diagnosis. If the client not tell them, make them do am.
Indeed.
In another way, if I come here now as I dey follow all everybody they talk, and I talk a story of my client, I not mention name, I not mention where I foresee the client, I not mention anything concerning the client, I never disclose anything concerning that client. Now story I just talk, even though na true story. Yeah, even though the client they listen to me here and I talk that story, e no mean say na because the client dey there they talk am. It is because that story I just want to use it to teach.
Yeah.
As I said, I not mention the client name. I not mention anything related to the client. Do you understand? Because it's against the ethics. It's against our ethics. But if anybody will do that, not be a health professional in quotes. It's not a good health professional.
Yeah, okay, more we go quickly because of time, and we'll now go on a very short break. Now, what if both couples they positive? Will it still affect the child? That is, the man they positive with HIV, the woman they positive with HIV, but now they don't born pikin. The pikin go get the virus, I be the pikin go they negative. Now in this person they ask. And then make I just add this one quickly
Yes.
because of time. It says how long for somebody where they on the medicine now for HIV, how long it would take before the viral load go come down very low? Maybe say you know go fit transmit them. How long? Make I allow you respond.
Okay, so even though if the two partners are positive, the man are positive, the woman are positive, then one born pikin, even though they give birth to pikin, the pikin go still be negative. It's just for them to do the right thing. Enroll into the program when they call prevention of mother to child transmission. When you enroll to that program, your child will be negative. You do so many other things for the child and for you, and your child will be negative. So that one is that. So how long will it take? So normally WHO say this person should have taken drug for at least 6 months. He go do test, is virally suppressed. Then he go continue to take drug for another 6 months. You do test, is another virally suppressed. That is, then you can say this person is really undetected. However, some people go take drug for just 3 months, 3 months, and they will be virally suppressed. They will get less than 50 for their viral load. And if they do it again by the 6th month, they go see dey like that. It means that those people are virally suppressed. They are undetected. But they need to maintain her. They need to maintain her. And the way to maintain her now to continue to take their medication as Dr. Fred.
Yes, now to take their medications as prescribed by their doctor. Okay, before we continue, now if you know, say you be content creator here and you never buy my course, go and get it quickly. If you're a content creator here and you never get my course, scan this code on your screen. This barcode on your screen, scan them. I'm saying this to you now because many people when they follow me, they cry. They cry, Dr. Fred, when I know they guide us. You know, one teach me how to do this content thing. You know, one explain to me, I they suffer, I they do this, I they give you updates now. Look at my face. Now me, they follow you talk. Scan this code on your screen, snap them, scan them, buy the course, watch them, Ask me any question you want to know about content creation. All the ones where I know, I will tell you. The ones where I don't know, I will find the answer. I will give them to you. Yeah, it is very cheap. Go and get it now so that you will know what you will not cry. Had I know tomorrow. Now, let's go back and take this question. He says, how many years can the person on treatment live? I hear say the drugs they cut their life short. Say they don't last up to 50 years. Meaning, say people wait they on the HIV medicine. You hear say they know they live long. Say the medicine they cut their life short. Oh God, I beg. Dr. Israel, oh yeah, help me answer them.
Well, that will not be true. I get a client when they 80 years and he still they take it in medication. It's about 80 years. In
I
fact, not be
beg,
just one. We
I
get up
beg,
to
talk am
four,
again.
five.
Talk am again emphatically. Make
I
this
say we
person
get
understand because
clients
I don't know who they
when
spread this. Yes.
we get clients when they up to 80 years and above. Not be one, not be two. We get more. We get many. And they are still taking their medication. And if you see some of them, they are so healthy, like they never start to live their life. That they still get more life to live. That's what I mean. So research have shown that the lifespan of people when get HIV, when they on their medication, and when they take them very well, and the lifespan of people when they negative, the difference is very minimal. When we say minimal, it means say they're not it's insignificant. They even show say people when get HIV, wait till they kill them pass. Na natural cause, not be even HIV. Say na natural cause. Mostly those wey dey on their medication. Yes, I know say yeah, HIV still dey kill people because we never really reach epidemiology control like that. We never really reach am completely. We know. However, if the person they take their medication very well, they can live as long as they want live. And not be the drug not they cut anybody lifespan. The drug not they reduce anybody life. They can't reduce it. Say you can't die before your age. No. So far you do the right thing, do your exercise, eat your normal food, balanced diet, build up your immune system. You are good to go. You are good to go. Dr. Fred.
Okay. Thank you. If you never share this video, share the live session. I they look you know they share. I they check the people where they share the live session right now. And I see say now only few people they share. No problem. This person says, and Dr. Fred, there are other viral infections that many do not know about, yes, but it's still a challenge to some married people, like herpes, mumps virus. My question is, can the person who is positive to this virus take antiviral drugs that HIV patients are taking? Your name is Young. Now, the answer is if you have a viral infection, they give antiviral agents, but you can't just wake up and start taking any medication like that. That person will need to speak with a doctor, and then they will come decide to place you on medication. Do you understand? But not that because this drug is called antiviral agent and it's an antiviral drug, medicine. Because you get a viral infection, you go just carry and go they take like that. No, you need to be seen. They will examine you, they will test you, and then they will come commence you on medication. Is that okay? Okay, now let's quickly. This person is saying, okay, so quickly, as we they try to round up because of time, somebody they asked for the comment section since I they see the comment. It says, how can I now prevent HIV? The ways to prevent HIV. They talk about medicines. What I hear say there's a medication that I can take and I'm not gonna get HIV. But before medication, I believe that there are other things that somebody can do, like abstinence, not to get HIV, like be faithful, like using protection and other things. So I'll allow Dr. Israel, make you just hammer on them again quickly, and then we'll come dey try to dey round up because our time don dey near for us to close.
Okay. To prevent HIV is just like preventing every other kind of diseases. We get what they call primary prevention, we get what they call secondary prevention, and even tertiary prevention. So when we talk about primary prevention, we try to prevent those who never get the disease, make them not get am at all. So secondary prevention can be those who already get the disease, make them not reinfect themselves with another type of the disease. While the third one can be those who already get the disease, make them not come they get complications. Or even though they get complication, make them fit treat am and make them come out from those complications. You can see that there are different parts of this prevention. Now, for the primary prevention, when we say we don't want to make those who never get am, we don't want to make them get am. Now that one we'll come to talk about the normal one, abstinence. You say, okay, no do anything when if it make you get HIV. But first, you need to know what are the ways when person fit take get HIV. The highest way is now through knacking, doing unprotected knacking with people we get the virus, or people when you don't even know their status. 2, now those way they use injection, needle stick injury, and all those things. And 3, now mother to child transmission. So when you don't put all those on for your head, you go come start to know how you go take prevent yourself. When we say abstinence, you need to, for knacking, you need to know your day now, your day. Then not use injectable, not do all those things so that you can protect yourself. Abstinence. Then the other two, be faithful. Now, this time we can't like tolerant to only the knacking aspect, because majority of people when get her, now through that means now it happen about 90% or so. So we can't say be faithful. Once say be faithful, that is if you get partner, make sure say now only one partner now you get. And make sure say your partner now only you now you get as well. So that make not go bring something can't give you for us. Then 3, can't say use rubber or condom. Yeah, because we know say some people cannot just they cannot just stay with one person. They want just do many things. So those kind of person use condom. I know say some people will say, they sweet. Hey, they sweet. Oh, there are some condom that when you use it go still be like say you not use condom. You go still be like normal. So use condom. Then the 4th one, that be the use of medication. We know say there are some people where they react to condoms. Now, what we've leave this I know I use that in sweet because I have said there are some condom there when you go use it go still be like normal. So, but because of some people where they react to condoms, and they need to do some things now that make medication the use of drugs. So we get the one what they call PEP, we get the one what they call PrEP. Now for the PEP, now post-exposure prophylaxis means say you don't expose yourself finish, you can't go take medication for 1 month, so that means you not come down with the virus. Then we get the one what they call PrEP. This PrEP is not, they can't divide it into 2. We get the one what they call oral PrEP, and we get the one what they call injectable PrEP. And the injectable PrEP now the one where they use injection. Now this injection, you get the one where they use every 2 months, and you get the one where they use every 6 months. Don't ask me whether I did in Nigeria, but you all know say those injection now so that they use them. Then the oral PrEP, they can divide that oral PrEP into 2. We get the one what they call daily oral PrEP, and we get the one what they call event-driven PrEP. So for the daily oral PrEP, it means say every day you go just dey take am. In fact, for everybody when they of substantial risk, daily oral PrEP is very important. It can be used. While for event-driven PrEP, now only man when be man. You understand what I talk? Only man when be man na fit use am. Or transgender woman and man from birth. When no they take any medication wey go come make them become woman. That is medication wey go come bring out their bunion come out, their bobby come out, or come change their face to come they look like, or change their voice to come make them look like a woman. There's all those hormonal medication. They know they take any of those things. Man, not be transgender man. Transgender man and woman FBU. So they talk about man from birth. So we call the cisgender men. So man from birth. When they born you biologically, they say you be man. Now all those people they fit take event-driven prep. Event-driven prep. Now to say when you get the event, that is when you want do the things, you want now that period you go take the medication. Many things today to talk about event-driven prep. So, but we're not going into it. You just know, say something like that day. If you want to get more information, go hospital. Go hospital. Or if you follow my page, I think I've said something about event-driven prep. You can actually listen to it. So these are ways we will fit to prevent ourselves. Other ways, though, in fact, in terms of prevention for HIV, we they call it like a collaboration, not be only one way. We get the biochemical now. I hear they talk so all this using of medication and all that, and we can't get what they call circumcision. Men go by circumcise themselves because they get so many things. Where we say they keep the virus, we go make them infect themselves or infect others. So we get the one social one and all that. When we say policies, they need to make some policies wey go help us to test ourselves. Another way now, another one na education. We need to know about HIV. We need to understand so that when we never they stigmatize people. Because if you stigmatize people, those people when you stigmatize, they're not going to go do their test. And if they not do their test and they are positive, they can come back and infect you tomorrow. So to prevent yourself, not stigmatize another person, because you never can tell who that person they close to for your cycle. May not be say that person when you stigmatize they close to now your partner. Okay, I don't talk. May I not come talk past them. Dr. Fred.
Okay, thank you very much. Now you get one comment. Somebody they talk for the comment section. Go to the hospital. This person sit down for comment section. If they ask question, where this, and they are telling you to go to the hospital. You don't want to go to the hospital and see your doctor. You want to sit down on social media and collect this. No, social media is to guide you, is to educate you. We don't try waiting. We feel try for here. If you sit down for your house or you sit down for social media and you no go hospital, you can mismanage yourself and give yourself more problem. So like we don't talk, get yourself tested, follow all the prevention, and not let anybody make you fear. Say HIV in a death sentence. No be death sentence. The medicine not they fire anybody. You know they kill anybody. You know they cut anybody life short. We are out of time. We are out of time, and many things there to talk about, but because we did so constrained with time, we will need to round them up here. And I go like again, if you never share this video, share the video, make your people come learn. If you know, say you know they follow, click on the follow button. Follow Dr. Israel. Dr. Israel, your page. Make I find your page handle again, sir. Put it online here. Let's see. Follow Dr. Israel quickly. In page day for up there so that you can learn some more. If you never get my course, get this course. Dr. Israel, any final comments?
Okay. My final comment is that on the 1st of December, an award is day. Award is day. So we try to celebrate the success when we don't reach in terms of how we don't take progress in the management of HIV and even prevention. Despite the problem we can't get by the beginning of this year. In fact, the problem we got at the beginning of this year not even coin the theme for this year World AIDS Day. Talks about we need to be responsible, we need to take every country or everybody need to put hands together make we really end this disease called this infection called HIV. So in your own little way, try to educate other people about, try to tell them, make they go do their test. And that's just what you can do. And please, if you join those way they stigmatize person, stop them. It's not good. Stop them. Another thing when I want to talk, yes, some people can be on medication and they see they get some symptoms. It can either be say, either they don't they fail for that medication, it means say they know they take their medication very well, or two, they are doing so many things that is reducing their immune system apart from HIV, because they make them they get other other diseases, other infection and other things. Now, the last one is that we don't see many things about there is cure for HIV online. Many people don't talk so many things. Don't put a lot of talk on social media. They say there's cure for HIV. There's cure for HIV. I don't cure HIV with this one. I don't cure HIV with that one. There's one leaf like that where you go boil, put put sugar, this one, put salt, even can put pepper, like say you dey cook soup. They don't talk so many things. I say make I let you know today. As at this point, HIV never still get cure, but we don't make a lot of progress. And the cure will come out one day. So they are still on process. And I want to use this medium to tell you, if you they say you get cure for HIV, you believe say you get the cure, I bet bring and come out. Bring her to the medical world. Make they test those things where you say be cure for HIV. Make they take and pass the normal process. Because not be bad thing. I keep on saying it. Not be bad thing. Say your medication or your whatever you bring can't cure HIV. Not be bad thing. Because if you get Nobel Prize for that, or Nobel Prize for that, Nobel Prize for that, I'm not sure saying I'm bad thing. I think it go even lift your name up, and people go. In fact, your name will come the history. Say yes, so now so person I bring the cure. So if you think say you get am, bring and come out to the medical field. Not they do one for person. Not they do one for your. I don't know as I want to talk. I'm not going to do one for one place. They use and they blackmail every other people. They collect their money. Thank you.
Yeah, thank you, Yeah, thank you, Dr. Israel. So if you never follow Dr. Israel, see him page name here. Now, Dr. Israel page name be this. Oh yeah, hurry up and follow him so that you will not miss out on important information. And I want to say thank you very much for joining. Don't forget that every Sunday by 8 p.m. to 9 p.m. Nigerian time, and we have been here for more than 5 years. So I beg, share this video to save your people. We do this to help you. Yourself, do your own to help your people. Like I always say, good life now waiting. Good life. That sense. See you next week, Sunday. Take care of yourself and have a wonderful day.